Dear colleagues, my name is Fishenko and I am a pioneer of UBE in Ukraine. I want to share with you my opinion about UBE technique. UBE is a method of unilateral biportal endoscopy designed for a treatment of degenerative disease in all parts of the spine. Unlike single-canal transforaminal endoscopy, this method uses two ports, one for imaging and one for instrument operation. Typically, 0 or 30-degree optics are used for UBE, and special instruments such as cuvettes, burrs, endoscopic shavers, RF, plasma electrodes, retractors, Kerenson and tertiary rogers are used in the walking canal. The UBE technique can also be used for endoscopic fusion surgery. The features of UBE. With UBE, any amount of decompression is possible with various types of spinal stenosis: central, lateral, foraminal, and extraforaminal. Due to the wide visualization of the surgical field, it is possible to perform selective decompression both of ipsilateral side and contralateral side, without disturbing the surrounding structures of the spine and preventing the ligaments and muscles. The main advantages of UBE is the small diameter of UBE scope, large working space, and wide range of motion. It is possible to use traditional surgical instruments for the spine, not limited with specific instruments. Good treatment options for any kind of spinal stenosis. Traditional posterior access to the spine. Short learning curve and suitable for all parts of the spine. So, thank you for your attention and see you in our Kyiv endoscopic spine course on 16th of April. Thank you. Bye.
Hi everyone, my name is Safruddin. I'm the chairman of Endoscopic Spine Surgery Society from Indonesia. I had done this surgery 5 years back after encountered some complication of my open traditional surgery. I found this kind of surgery is technically demanding, but the result is rewarding. I hope we can work together in the one platform. Lastly, as a chairman of Endoscopic Spine Surgery Society from Indonesia, I would like to invite all of you to join our Asian Minimal Invasive Spine Society, which will held in the 2nd and the 3rd 2021 this June online and the 2022 June offline. Please send the paper to me through my email husin.icap@gmail.com. Bye.
Hello, I'm Coach Sairo, Professor and Chairman of Tokushima University, Tokushima, Japan. Also, I'm a Chairman of Japanese Society of Minimally Invasive Spine Surgery. I started endoscopic surgery in 2000, 21 years ago. At the beginning, I was doing MED technique, micro-endoscopic discectomy. It is now called an endoscopic assisted tubular surgery. In 2010, 11 years ago, I moved to a transforaminal percutaneous endoscopic surgery under the local anesthesia. This is very important. It can be done under the local anesthesia. Now it is called single portal full endoscopic surgery. For these 11 years, development of the technology is very rapid. Currently, using the transforaminal single portal full endoscope, I can treat any type of herniated nucleus pulposus and decompression of lumbar spinal canal stenosis. Recently, I started this technique to interdiscal surgery for discogenic pain and type 1 modic change. Finally, I use this technique for transcambing lumbar interbody fusion. Everybody, let's make the future gold standard together using endoscopic technology. Thank you very much. See you soon.
Hello everyone, I'm Dr. Son from South Korea. Big congratulations! And I send heartfelt applause to Dr. Fishenko for your leadership to host UBE training course in Kyiv and last. Day by day, more spine endoscopists and also open surgeons are getting so much interested to learn what is UBE. And I'm pleased to know many spine surgeons come to acknowledge the differentiated functions of the UBE surgical technique. I made this name UBE about 19 years ago. Now I guess almost all of us here already know what is UBE, that is Unilateral Biportal Endoscopy. During spine surgery operation, endoscopists feel stifling limitation of their action, which is mainly comes from the limited choices of the instruments, and open surgery surgeons worry that they cannot run away from causing massive tissue damage. That was the reason where UBE was born and why many spine surgeons today are eager to learn UBE. With the traditional microscope and uniportal endoscope system, surgeons become just system operator who follows the pathway, the machine and system directly. But UBE puts you in the center and initiative position to make you the responsible spine surgeon who has to make the free will and customize the treatment solution depending on different patient situation. It makes you a real surgeon-like surgeon. I'm so sure with that. With the UBE, you can make the best optimal surgical option for patient, which is full of accessibility and manageability, but still maintaining uncompromising benefit of minimal invasiveness. I'm sure this first UBE Congress in Ukraine is going to be the start line of breaking the old paradigm and getting closer to sublime mission of better patient care. I cordially welcome many promising spine surgeons participate in this Congress and pray for you to advance as the innovative surgical content creating surgeons. That is possible with UBE. Thanks, good luck, and God bless you. I hope to see you soon in person in near future. Take care. Bye.
Hi, my friends, my friend doctors and colleagues in our specialization, neurospinal and endoscopic surgery. I am Dr. Professor Syed Morsi, Head of Department of Neurospinal and Endoscopy and Mala-Invasive Surgery in Odessa Medical University, Ukraine. We many years special doing in this direction and making very progressive in mala-invasive treatment, endoscopy, and neurospinal surgery. Making more operation, transfemoral and infralaminar. Only in the last 2 years started UB biportal endoscopy in our region. We teach students, national students and foreign students in many countries, and specialization, internatura, ordinatura and PhD. In the last year, many our doctors, surgeons, which started our course of specialization. Very be glad to hear and see you in our conference in Ukraine in 16 April in this year. Thank you, my friend, for your attention.
Dear colleagues, my name is Aguin. I am an orthopedic spine surgeon and the director of Spine Center at Bursa Medikabil International Hospital. And I am one of the moderators of and instructors of the endoscopic spine surgery model in collaboration with HG Learning. I've been performing spine endoscopy. It has been part of my routine spine surgery for the last 13 years. I started with the transforaminal uniportal endoscopic techniques, then performed the tubular endoscopy assisted spine surgery. All this technique had some limitation, and always I felt the necessity of different techniques. Fortunately, in a few recent years, spine endoscopic techniques have evolved to perform different indications such as stenosis and instabilities. An indication for spine endoscopy also widened day by day besides technical developments of spine endoscopy. Unilateral biportal endoscopy is a completely new and developed technique which I have been performing for 4 years, and I performed more than 4,000 cases. UBE has two separated portals which we can use the endoscopes and the instruments independently, and because of this almost all the target points became accessible where we could not reach in older techniques. UBE surgery has minimal muscle damage and better visualization compared to others. Today, we can operate endoscopically for many spine diseases such as disc pathologies, stenosis, and instabilities. In this meeting, we will see the latest developments of the UBE besides basic concepts and basic applications. Thank you.
Hello, good evening. My name is Dr. Alikum. I'm from India. I welcome you to the Kyiv conference conducted by ISUBE, chaired by Master Son, and I thank Dr. Fishenko for having extended me this invitation. UBE or Unilateral Biportal Endoscopy is the brainchild that has emerged from South Korea, with Dr. Master Son being one of its propounders. It is a wonderful spine endoscopy technique which complements and takes care of all posterior and majority of the anterior problems associated with the degenerative spine. The small diameter of the scope and normal working instruments which can be used makes it economically very friendly for all aspiring and young learning neurosurgeons and orthopedic spine surgeons. I welcome all of you to attend this conference to learn all about UBE, adapt to it. It is a changing world, and my genuine suggestion is to climb under the bus before it leaves the bus stop. So welcome once again.
Dear colleagues, my name is Asrafi Rizky Gatam. I am an orthopedic spine surgeon from Jakarta, Indonesia. Performing unilateral biportal endoscopy is part of my routine spine operation in the last 5 years. The two separate portals for visualization and instrument insertion, making this procedure become limitless for decompression and even fusion. Not only in the lumbar spine, but the procedure continues to develop for procedure in the cervical and also in the thoracic spine. In the near future, we could probably say goodbye to conventional open and microscopic spine surgery. From my hometown in Jakarta, I wish to see all of the UBE masters on April 16, 2021, and hopefully we can continue to influence more surgeons to adapt biportal spine endoscopy. Thank you.
Hello everyone, I am Dr. Alexander Kovalenko from Ukrainian Institute of Traumatology and Orthopedics. I currently perform rehabilitation programs with patients after endoscopy spine surgery. For the first time in Ukraine, our surgeons have introduced the method of endoscopic treatment of such diseases as herniated disc and spinal canal stenosis. And today our institute is a leader in Ukraine in terms of these methods of operation. Today patients are still little aware of endoscopic surgery, so one of the most common questions is how long will I be bedridden, or is it true that I won't be able to get up for half a year? And we have to convince the patient and that this type of surgical treatment is minimally traumatic and they will be able to return to their normal life in a short period of time. Our rehabilitation program is based on international protocols as well as personal development that allows the patient to return to normal life as quickly as possible. This is what my lecture will be about. I hope you can highlight useful and interesting things for yourself. See you at the conference on April 16. Goodbye.
Hello everyone, nice to meet you all in this ISUBE Society meeting. My name is Harman. I'm an orthopedic spine surgeon from Indonesia. I've been practicing endoscopic spine surgery for about 5 years, and I started with uniportal access, and lately I study also a biportal access. What I found a big difference between uniportal access and biportal access is the way of doing endoscopic lumbar fusion. Using biportal access, for me, it's much easier to perform endoscopic lumbar fusion. And I will share with you in my presentation the advantage of using expandable cages in endoscopic lumbar fusion surgery. So, hope to see you all and stay focused on endoscopic spine surgery because, in my opinion, it will be the future of spine surgery. Thank you.
Hello dear colleagues, my name is Dr. Taras Voloshin. I am from Ukraine, Ternopil University Hospital. My team and me was one of the first in Ukraine who started with full endoscopic spine surgery in 2017. Since then, community of endoscopic spine surgery in Ukraine is growing, and I'm happy to help some of the colleagues to start with it. It is my privilege to share my experience in monoportal endoscopic spine surgery. However, I'm looking forward to learn more about UBE technique during this conference in order to provide better care to our patients. Hope to have your help in future in my UBE journey. I believe that with everybody's effort, minimally invasive spine surgery in Ukraine will grow and will get better and better and will benefit our patient, especially those with lumbar spinal stenosis. Finally, I wish conference a complete success.
Assalamualaikum. Hello everyone, my name is Adam Mulyono, member of Medical Club Indonesia, Indonesian Orthopedic Spine Society. I work in Gajah Mada University Hospital. It's a teaching hospital in Indonesia. I currently perform uniportal surgery for 3 years. I had 6 months endoscopic spine fellowship in Mumbai, India under Dr. Malcolm Pistonji and Dr. Satish Chandra Kure, and PSLD with Dr. Kang Ta'lim in his YouTube channel Chaklim. And until now, I'm doing more than 100 cases of endoscopic surgery. Mostly transforaminal under local anesthesia and PSLD under general anesthesia. To improve my skill in endoscopic spinal field, I like to learn more about the different skills such as UBE. I watch UBE video channel by Dr. Sang Kyuson a lot in UBE Academy to learn UBE, following UBE Society in Facebook and also Society of PSLD. It helps a lot. Thank you very much for this good chance from Ukrainian Endoscopic Spinal Society for offering me the platform. Hope to have your help in the future in my UBE journey. Thank you very much.
Bonjour, good morning.
I am Dr. Maxi from South of France, Grasse. I am an orthopedic spine surgeon focused on UBO spine surgery. During my residency, I used the solar system. Thanks Professor Luec, 10 years ago during my fellowship in Bordeaux, I tested the first time on endoscopy surgery. It was a uniportal endocanalaire technique, and where I realized the benefits for endoscopy spine surgery. Less infection, less postoperative pain, less fibrosis, and fast recovery. The first arthroscopy in France was done in 1970. Now no one here will think to operate with me without arthroscopy. I worked 5 years in Monaco Public Hospital, in which time I did almost 100 cases of foraminal endoscopy. And I think in 20 years no one will operate the spine without endoscopy. I've had many years experience on uniportal surgery, but now I believe that it offers more possibilities. I am really happy to have a chance to be part of this conference and speak about the possibility to develop endoscopy spine surgery techniques.
Dear colleagues, I am Nguyen Ngọc Thoy, orthopedic spine surgeon from Ho Chi Minh City Medical Center, Vietnam. It's my honor to join April 16th, 2021 Kyiv, Ukraine endoscopic spine surgery online course. I did unilateral biportal endoscopy 4 years ago from learning that technique in the internet, YouTube, Korean UB Society, and especially from Dr. Son. And now I have a chance to learn it from spine surgeons around the world. UB or unilateral biportal endoscopy is a good technique combine endoscopy surgery and microsurgery. So we can do every kind of discectomy, decompression, and also fusion. The development of UB may be the promising spine surgery future. Some major open surgery will be replaced by UB, and the fusion indication may be decreased in some stability spine diseases. I hope that the webinar will be successful and more spine surgeons can do UB. See you soon.
Nice to see you, spine surgeons in Ukraine. I'm Takaki Yoshimizu from Japan. Thank you for inviting our team to this conference. Biportal is a hope for young spine surgeons, and we want to cooperate with development of this technique. UBE can adapt the basic technique of spine surgery and endoscopic surgery like arthroscope. It can be the advantage to make learning curve short. I want to share my opinion about the point of introducing UBE. I'm looking forward to see you on April 16th. With my all gratitude from Japan. See you.
Greeting everyone. My name is Dawson Tian, come from China, working as a spinal surgeon in the second hospital of Anhui Medical University. I started working at UBE surgery in 2018 and have accomplished more than 500 cases. Since 2019, we have organized 5 UBE training courses with more than 100 training personnel and also participated in a number of domestic and international UBE special conferences. I hope that through this conference, we can promote the development of technology UBE jointly. Finally, I wish the conference a complete success. Thank you.
Hello, I'm Javi from China. With the help of Dawson, I began to understand the UBE technique. I have performed cases of cervical, thoracic, and lumbar. UBE is indeed an excellent technique, especially for endoscopic treatment of the difficult spinal cases. I hope that through such an international UBE technique platform, we can make common progress. Finally, I wish this conference great success. Thank you, everyone.
Dear President of the conference, and hello everyone. I'm Dr. Fu, Professor and Director for the Department of Orthopedics at the second affiliated hospital of Southwest Medical University, Sichuan Province, China. I studied my career as a orthopedic doctor. Then I have been engaged in trauma, spine, joint, and sports medicine, and also received professional training. 10 years ago, after visiting Atos Clinic in Heidelberg, Germany, I worked in sport medicine and joint surgery. Years ago, after I contacted with UBE by chance, I realized that sport medicine is not only about joints, but also a technique can help all patients in the field of the spine. With no more than 1 year of hard work, we have gradually solved many difficulties in UBE. So far, more than 100 UBE surgeries has been carried out, from the most basic decompression of spinal stenosis to the intervertebral fusion. Moreover, we also have carried out 2 courses in the southwest China. From my experience, UBE should be a better choice for the surgeons because UBE also have the advantages with minimal invasive clear surgery field and less bleeding. The technique has a short learning curve who should have a foundation in arthroscopy and spine surgery. Finally, I wish the conference a complete success and then let UBE help more patients with spinal disease. Thank you.
Morning everyone, my name is Dawson Tian. I have worked in Tianjin Hospital in Tianjin, China for 20 years and in the Department of Spinal Surgery for 17 years. 6 years ago, we founded the Department of Minimal Invasive Spinal Surgery and I serve as the head of the department. I specialized in endoscopic surgery. For example, I used mobile micro endoscopic discectomy for more than 5,000 patients of lumbar and cervical disc herniation and stenosis. I used percutaneous endoscopic surgery with one portal for more than 5,000 patients of stenosis and disc herniation. I have also thoracoscopic surgery for scoliosis and no compression. In recent years, I used unilateral biportal endoscopic surgery, UBE, for stenosis with and without disc herniation, for decompression and discectomy, and also UBE assisted fusion for spondylolisthesis. So I think this is a good opportunity for me to learn more knowledge and experience. Thank you very much for this great opportunity.
Fishenko, the chairman of the board of the Ukrainian Association of Endoscopic Spinal Surgery. On behalf of the Ukrainian Association of Endoscopic Spine Surgery and International Society of Unilateral Biportal Endoscopy, welcome to the Kyiv Endoscopic Spinal Surgery course. We are excited to see here so many experts and distinguished speakers from different leading institutions worldwide who are dedicated to educating the next generation of endoscopic spine surgeons. We strive to make this conference experience and enjoyable and informative to all. Kyiv Endoscopic Spinal Surgery course not just dedicated to learning more about the endoscopic spine surgery, but most important, we also wish to create an educational platform where our fellows could learn more about the exciting field as well. With this idea and the right planning and hard work, we were able to bring this conference into existence. Hopefully, with time, the conference will grow and evolve. The message and the goal of the conference is to provide an event where neurosurgeons and orthopedic surgeons who are interested in endoscopic spine surgery can learn more about the UBE, deepening and acquiring new knowledge and skills on endoscopic methods of treating degenerative disease of the spine, such as new unilateral biportal endoscopy. To put the conference together takes a lot of dedications, communications, and professionalism. Of course, this event would not happen without the help of our supporters. Thank you to the Bonds Company. We are very honored of your support and presence here at the conference. Thanks to our speakers to volunteering your time to be here with us. We are glad that you are here. We hope and enjoy the conference that was made a reality by planning community, and we hope you take a knowledge you're learning here today and use it better your lives and careers. Thank you. Today, we are deeply honored to invite Dr. Sang-Kyu Son from South Korea, Dr. Zhou Yu from China, Dr. Liu Xakongang from China, Dr. Kyoichi Sayoro from Japan, Dr. Safruddin Hussein from Indonesia, Dr. Malcon Pestonia from India, Javer Olivia from Mexico, Dr. Hayati Aguin from Turkey, Dr. Corinne Maxime Charlie from France, Dr. Ngoc Toi from Vietnam, Dr. Said Musen from Ukraine, Dr. Valentin Piantkovsky from Ukraine, Dr. Alexander Kovalenko from Ukraine, Dr. Taras Voloshin from Ukraine, Dr. Kanya Sasaki from Japan, Dr. Takaki Yoshimizu from Japan, Dr. Zhu Kaija from China, Dr. Liu Zheng from China, Dr. Xu Baoshan from China, Dr. Chan Dijun from China, Dr. Xu Weibing from China, Dr. Zhang Wein from China, Dr. Fu Shen from China, Dr. Asrafi Razi Katam from Indonesia, Dr. Hamamatia Marahanfa from Indonesia, Dr. Adam Moyapo from Indonesia. Even under the situation difficulties and limitation due to the COVID-19 pandemic, we did not stop working and improving on minimally invasive technique in endoscopic spine surgery. Hope today's international conference will provide a good opportunity for learning and communication for the neurosurgeons and orthopedic surgeons on the new knowledge and skills on minimal invasive, namely endoscopic method of treating degenerative disease of the spine. Now, with a great honor, I would like to welcome our first VIP guest, the pioneer in fields of UBE, my teacher, Dr. Sang-Kyu Son from Park Won-wook Hospital in Busan, Korea, Director of Overseas Exchanges, member of Korean Minimal Invasive Spine Surgery Society, member of Korea Research Society of Endoscopic Spine Surgery, to give his opening speech on the conference.
Hello everyone, I'm Dr. Song from South Korea. Big congratulations and heartfelt applause to Dr. Fishenko for your leadership to host UB webinar in Kyiv. Also very much pleased to see ISUBE co-chairman Dr. Zhou and Dr. Liu Xiaokang to host us in this big event. Day by day, more spine endoscopists and also open spine surgeons are getting so much interested to learn what is UBE. And I'm so surprised to know many young spine surgeons come to acknowledge the differentiated functions of the UBE as a patient-centered surgical technique. I made this name UBE about 18 years ago. Now, I guess almost all of us here already know what is UBE, that is Unilateral Biportal Endoscopy. With UBE, you can apply the best optimal surgical option for patient. which is full of accessibility and manageability, but still performing uncompromising benefits of minimal invasiveness. I'm sure this first UB Congress in Ukraine is going to be the very start line of breaking the old paradigm and getting closer to perform the sublime mission of better patient care for spine patients in need. I'm cordially welcome many promising spine surgeons participate in this Congress and pray for you to advance as a patient-centered spine surgeons who can create innovative surgical treatment content through UB. Last but not least, I really appreciate for all of you who did lots of hard work to make this webinar come to happen for us. Good luck and God bless all of you to win over the pandemic. I hope to see you soon in person in near future. Thank you. Take care.
Thank you, Dr. Son. Thank you very much. Now, with the warmest applause, let's welcome our second VIP guest, Dr. Liu Xangong from Binjin Juran Hospital, China, Deputy Chairman of Orthopedic Branch of Binjin Medical Association, leader in Minimal Invasive Group, member of the Standing Committee of the Chinese Hospital Association, Deputy Chairman of the Medical Legal System Community. Due to he was an important academic report today, he recorded a video for opening speech. Please let our staff to play it.
Dear colleagues, I'm Professor Liu Xiaoguang from China Peking University Third Hospital. Thanks, Dr. Fishenko. It's my honor to be invited attending the minimally invasive spine surgery course of Ukraine and the International Society UBE. As we are sure, everyone knows that the whole world is going through a hard time of COVID-19. This course is held in a hybrid format that combines offline and online. Although it's a mix of online and offline, participants can learn the latest in every field of spine surgery techniques from UBE, include the UBE learning curve, in-body fusion UBE, thoracic and cervical approach by UBE. I really hope everyone can learn a lot of useful knowledge from this exciting course. Thank you.
Thanks to our professor's warming blessings, our conference now officially starts. Let's welcome Dr. Xu Baoshan to host the first part of the lecture. Dr. Xu Baoshan from Tianjin Hospital, China. Welcome.
Good morning, everyone. I'm Xu Baoshan from Tianjin Hospital in China. It's my great honor to attend this conference. Now, let's welcome the first speaker, Dr. Song, Professor Song from North Korea, to give us the first speech. His topic is a tip and a trick of thoracic surgery by UBE. Welcome, Professor Song.